They were aspiring female physique athletes, so
Hmm.
presumably female bodybuilders of some sort.
Enhanced.
So what about women that are trained? So this was kind of an interesting population of trained women because, for one, they were only 21 years old, but they were aspiring female physique athletes, so presumably female bodybuilders of some sort.
Enhanced.
Not reported. This is something that we can't see because it's behind a paywall. I would presume at 21, they shouldn't be enhanced. These
Just
barely
SARMs
out of
then.
high school at that point.
Peptides. and
Peptides,
SARMs, yeah.
protons.
It's like what Ryan Humiston said. He wishes that there was peptides like those around, like MK677 when he was 20.
I thought Mike O'Hearn said that.
Mike O'Hearn also said that.
Okay.
Anyway,
but this was
we digress a little bit.
This was an 8-week time period. So to your point, anytime you have a group of like trained individuals versus individuals who have never trained, there is going to be a higher penetrance of like performance enhancing drug use. I think it's like, depending on the paper you look at, 1 in 10 to 1 in 4 people in a commercial gym, like in the men, are going to have used something in the past or be using something currently. So keep that in mind.
Yes, peptides count. Yes, SARMs count. Yes, if you played high school football and took GNC supplements with Superdrol or whatnot, or methyltrin, then yes, that also counts. And some oral contraceptives arguably could count as well. But anyway, back to the study, they compared 2 groups, high protein and low protein. I suppose you could also make the case that for enhanced athletes, very high protein diets, just because of the nitrogen retention benefit, could make more of a difference.
Yeah, and this is actually a good comparison of high protein versus low protein. We'll talk about another study later, which I thought was not a particularly good, a good separation of high and low protein.
Yep.
But this one, there's actually a substantial difference. So high protein was a touch over 1 pound per gram, so 2.5 grams per kilogram. And then low protein was 0.9 grams per kilogram. And I think that's actually pretty close to the RDA, if I'm a little bit sketchy on the kilogram to pound conversions, but I think that's about what the RDA lands at. So not a lot of protein intake by like our standards or athlete standards.
Yeah. And it's 1 pound to 2.2 kilograms. And the average weight looks like it was 134 pounds. So I guess the takeaway from this result would be, it's 2 different scenarios. If you have a group that's at 130 pounds total versus a group that's at 260 pounds total, just doubling the protein will not get you the same result if you double the body weight.
Yeah, that's true. I think looking at the lean mass, or even there's some like thinking of like ideal lean body mass, and I'm not an incredible stickler on the like high protein. People certainly want to get the best results out of what they're aiming for, like the work they're putting in. Mm-hmm. But even the low protein group here, I'll run through those results because they improved their body composition in a time period of 8 weeks. So it's not like you're just spinning your wheels, exercising without eating enough protein. They gained a little over 1 pound of muscle, 0.6 kilograms, and they lost 0.7 kilograms of fat. So the scale did not move for these individuals, but they did they had some body recomposition in a pretty short time frame.
Yep.
Now that was augmented by the high protein group. They gained 2.1 kilograms of muscle. So that's
almost 4.5 pounds.
Pretty substantial.
That's a lot. Yeah. 4.5 pounds of muscle and 2 pounds of fat.
Yeah. Lost 1.1 kilos of fat. So the scale moved 2 pounds for them, but they would probably look markedly different from the beginning of the study to the end of the study, depending on their body fat at the beginning, which again, we don't have access to. But that's quite a bit for 8 weeks. And perhaps these people just weren't eating a lot of protein at baseline. So
likely.
As you mentioned, they get more of that nitrogen retention. So it's looks like more lean body mass, but it is kind of exaggerating the true lean tissue that they're accruing.
Yeah. You could even make the case for a 20-year-old female, 130 pounds, as you mentioned. Very few of them are getting enough protein in the diet. Dr. Gabrielle Lyon has some great info about this. A lot of it's specific to females. But the benefits of a high protein diet are not necessarily specific to females. One good biomarker to look at is blood urea nitrogen. If your BUN is not a bit on the higher end, then you're not breaking down a lot of protein into urea. And obviously that's not a hard and fast case. Also track your protein and know your protein goal. But that is a sign in many cases. I see a high BUN, and these are individuals that consistently eat a lot of protein.
Yeah, very common in an athletic population or a population that weight trains or eats more protein. And one reason that this could have been kind of a weird looking study on a result standpoint is that it was not DEXA data, but it doesn't say specifically what type of data it was.
That's true.